Welcome. In this video, we're covering the top 10 medications you absolutely must know before taking the NCLEX in 2026. These are the high-yield drugs that repeatedly appear in priority, pharmacology, delegation, and next-generation NCLEX questions. As you work through each question, focus on the medication's indications, major side effects, antidotes, nursing priorities, and critical laboratory values. Grab a notebook, test yourself before looking at the answers, and let's strengthen your clinical judgment one question at a time. Question 1. A 58-year-old client with type 1 diabetes mellitus is admitted with diabetic ketoacidosis. After initial fluid resuscitation, the provider prescribes a continuous 4 infusion of regular insulin. 2 hours into therapy, the client's blood glucose decreases from 560 milligrams per deciliter to 260 milligrams per deciliter. Current laboratory results reveal potassium of 3.2 milliequivalent/L, bicarbonate of 18 milliequivalent/L, and urine output averaging 60 milliliters per hour. The client remains alert and oriented. Which nursing action is the priority at this time? A. Continue the insulin infusion as prescribed. B. Stop the insulin infusion and notify the provider immediately. C. Administer 4 potassium replacement as prescribed while closely monitoring cardiac rhythm. D. Encourage the client to consume orange juice. Answer: C. Administer 4 potassium replacement as prescribed while closely monitoring cardiac rhythm. Rationale: insulin drives potassium into cells, increasing the risk of life-threatening hypokalemia. A potassium level of 3.2 milliequivalent/L requires replacement and continuous ECG monitoring, while insulin therapy continues according to protocol. Oral juice is inappropriate in DKA management. Question 2. A client receiving an unfractionated heparin infusion for a pulmonary embolism develops bleeding from the gums during oral care. Laboratory results show an activated partial thromboplastin time, APTT, of 112 seconds. Which action should the nurse anticipate first? A. Administer vitamin K. B. Stop the heparin infusion and prepare to administer protamine sulfate. C. Administer fresh frozen plasma immediately. D. Continue the infusion because gum bleeding is expected. Answer: B. Stop the heparin infusion and prepare to administer protamine sulfate. Rationale: a markedly elevated APTT with active bleeding indicates excessive anticoagulation. The nurse should stop the heparin infusion and anticipate administration of protamine sulfate, the antidote for heparin. Question 3. A client taking warfarin for chronic atrial fibrillation arrives in the emergency department after reporting black, tarry stools for 2 days. Laboratory results reveal an INR of 6.8 and a hemoglobin level lower than the previous week. Which prescription should the nurse expect? A. Increase the warfarin dose. B. Administer vitamin K. C. Administer protamine sulfate. D. Begin aspirin therapy. Answer: B. Administer vitamin K. Rationale: an INR of 6.8 with evidence of gastrointestinal bleeding indicates excessive warfarin effect. Vitamin K is the antidote used to reverse anticoagulation. Question 4. A 76-year-old client with heart failure has been taking Digoxin for several months. During assessment, the client reports nausea, decreased appetite, blurred yellow vision, and fatigue. The apical pulse is 52 beats/minute, and the potassium level is 2.9 milliequivalent/L. Which nursing intervention is most appropriate? A. Administer the scheduled Digoxin dose. B. Hold Digoxin and notify the provider immediately. C. Encourage increased fluid intake only. D. Administer calcium gluconate. Answer: B. Hold Digoxin and notify the provider immediately. Rationale: bradycardia, gastrointestinal symptoms, yellow vision, and hypokalemia strongly suggest Digoxin toxicity. The medication should be withheld and the provider notified immediately. Question 5. A client receiving 4 furosemide for acute pulmonary edema begins complaining of dizziness and muscle cramps. The cardiac monitor displays frequent premature ventricular contractions, PVCs. Which laboratory value is most concerning? A. Sodium 138 milliequivalent/L. B. Potassium 2.8 milliequivalent/L. C. Calcium 9.2 milligrams per deciliter. D. Glucose 105 milligrams per deciliter. Answer. B. Potassium 2.8 milliequivalent/L. Rationale. Furosemide commonly causes potassium loss. Severe hypokalemia increases the risk for dysrhythmias, such as PVCs, and requires prompt correction. Question 6. A postoperative client receives morphine for pain control. 30 minutes later, the nurse notes the client is difficult to arouse, has pinpoint pupils, a respiratory rate of 7 breaths/minute, and an oxygen saturation of 84%. Which action should the nurse perform first? A. Encourage deep breathing. B. Administer naloxone as prescribed. C. Increase the morphine dose. D. Reassess in 30 minutes. Answer. B. Administer naloxone as prescribed. Rationale. Respiratory depression with decreased consciousness and pinpoint pupils indicates opioid overdose. Naloxone is the priority intervention. Question 7. A client receiving epinephrine for anaphylaxis develops improved airway patency, but now reports palpitations and tremors. Which nursing interpretation is most accurate? A. These findings indicate worsening anaphylaxis. B. The medication should be discontinued permanently. C. These are expected effects of epinephrine. D. The client is developing digoxin toxicity. Answer. C. These are expected effects of epinephrine. Rationale. Tachycardia, palpitations, anxiety, and tremors are common expected effects of epinephrine because of its beta-adrenergic stimulation. Question 8. A provider prescribes potassium chloride for a client whose serum potassium is 2.7 milliequivalent/L. Which nursing action is appropriate? A. Administer 4 push over 2 minutes. B. Verify adequate urine output before administration. C. Mix potassium with sterile water and administer rapidly. D. Delay administration until after meals. Answer. B. Verify adequate urine output before administration. Rationale. Potassium should never be given 4 push. Adequate renal function and urine output must be confirmed before replacement to prevent dangerous hyperkalemia. Question 9. A pregnant client receiving magnesium sulfate for severe preeclampsia develops absent deep tendon reflexes, a respiratory rate of 9 breaths/minute, and urine output of 20 milliliters per hour. Which medication should the nurse prepare to administer? A. Vitamin K. B. Calcium gluconate. C. Protamine sulfate. D. Naloxone. Answer. B. Calcium gluconate. Rationale. Absent reflexes, respiratory depression, and oliguria are signs of magnesium toxicity. Calcium gluconate is the antidote. Question 10. A client receiving vancomycin suddenly develops flushing of the face and neck, itching, and hypotension shortly after the infusion begins. Which action should the nurse take first? A. Increase the infusion rate. B. Stop or slow the infusion and assess the client. C. Administer digoxin. D. Continue the infusion because this is expected. Answer. B. Stop or slow the infusion and assess the client. Rationale. Rapid vancomycin infusion can cause red man syndrome, characterized by flushing, itching, and hypotension. The infusion should be stopped or slowed, and the client assessed. Question 11. A 64-year-old client with type 2 diabetes mellitus has been receiving subcutaneous insulin glargine every evening and insulin lispro before meals. Before breakfast, the nurse checks the capillary blood glucose and obtains a result of 62 milligrams per deciliter. The client is awake, alert, and reports feeling shaky and diaphoretic. Breakfast trays have not yet arrived. Which nursing action is the priority? A. Administer the prescribed insulin lispro immediately. B. Give the client 15 g of a rapid-acting carbohydrate and recheck the blood glucose in 15 minutes. C. Administer glucagon IM immediately. D. Hold all insulin for the next 24 hours. Answer. B. Give the client 15 g of a rapid-acting carbohydrate and recheck the blood glucose in 15 minutes. Rationale. A conscious client with symptomatic hypoglycemia should receive 15 g of a fast-acting carbohydrate, followed by reassessment in 15 minutes. Glucagon is reserved for clients who are unconscious or unable to swallow. Question 12. A client with deep vein thrombosis has been receiving unfractionated heparin for 48 hours. The platelet count has decreased from 245,000/mm superscript 3 to 82,000/mm superscript 3. The client reports new pain and swelling in the opposite leg. Which nursing action is most appropriate? A. Increase the heparin infusion rate. B. Continue the infusion because thrombocytopenia is expected. C. Stop the heparin infusion and notify the provider immediately. D. Administer aspirin. Answer. C. Stop the heparin infusion and notify the provider immediately. Rationale. A significant platelet drop with new thrombosis suggests heparin-induced thrombocytopenia, HIT. Heparin must be discontinued immediately because continuing therapy increases the risk of life-threatening clot formation. Question 13. A client taking warfarin asks the nurse which meal demonstrates an understanding of dietary teaching. A. Spinach salad with kale smoothie. B. Broccoli and Brussels sprouts. C. Grilled chicken, brown rice, and green beans. D. Large serving of collard greens. Answer. C. Grilled chicken, brown rice, and green beans. Rationale. Clients taking warfarin should maintain a consistent vitamin K intake. Green beans are relatively low in vitamin K, whereas spinach, kale, broccoli, Brussels sprouts, and collard greens are high in vitamin K and can reduce warfarin's effectiveness if intake changes significantly. Question 14. A client with chronic heart failure is prescribed digoxin. Before administering the medication, the nurse assesses an apical pulse of 56 beats/minute. The client denies symptoms but is resting comfortably. What is the nurse's best action? A. Administer the medication because the client has no symptoms. B. Hold the digoxin dose and notify the provider. C. Administer half the prescribed dose. D. Reassess in 4 hours and then administer the medication. Answer. B. Hold the digoxin dose and notify the provider. Rationale. Digoxin is generally withheld if the adult apical pulse is below 60 beats/minute because of the risk of worsening bradycardia. Question 15. A client hospitalized for heart failure receives furosemide. 4 hours later, the nurse notes a blood pressure of 88 to 52 mmHg, dry mucous membranes, and decreased skin turgor. Which finding indicates the medication is causing excessive fluid loss? A. Weight gain of 2 kilograms. B. Bounding peripheral pulses. C. Orthostatic hypotension with dizziness upon standing. D. Bilateral crackles at the lung bases. Answer. C. Orthostatic hypotension with dizziness upon standing. Rationale. Excessive diuresis can lead to hypovolemia, resulting in orthostatic hypotension, dehydration, and dizziness. Question 16. A postoperative client receiving morphine through a patient-controlled analgesia, PCA, pump asks a family member to press the PCA button while the client sleeps. What is the nurse's best response? A. Allow the family member to press the button every hour. B. Explain that only the client should activate the PCA button. C. Increase the continuous infusion rate. D. Disconnect the PCA pump immediately. Answer. B. Explain that only the client should activate the PCA button. Rationale. Only the client should press the PCA button. This safety feature helps prevent opioid overdose and respiratory depression. Question 17. A client with severe anaphylaxis receives intramuscular epinephrine. 5 minutes later, the wheezing has resolved and blood pressure has improved. Which finding requires immediate follow-up? A. Mild anxiety. B. Heart rate of 112 beats/minute. C. Persistent inspiratory stridor with increasing difficulty breathing. D. Slight hand tremor. Answer. C. Persistent inspiratory stridor with increasing difficulty breathing. Rationale. Continued airway obstruction despite epinephrine suggests persistent or worsening anaphylaxis and requires immediate intervention to secure the airway. Question 18. A client receiving 4-potassium chloride reports burning at the 4-insertion site. The infusion pump is functioning properly. Which nursing action is most appropriate? A. Increase the infusion rate. B. Assess the 4 site for infiltration or phlebitis. C. Administer the remaining medication by 4 push. D. Ignore the complaint because burning is expected. Answer. B. Assess the foresight for infiltration or phlebitis. Rationale. Potassium chloride is irritating to veins. Burning may indicate phlebitis or infiltration, requiring prompt assessment and possible foresight change. Question 19. A client receiving magnesium sulfate for preeclampsia has the following assessment findings. Respiratory rate, 16 breaths/minute. Urine output, 45 milliliters per hour. Patellar reflexes, 2+. Serum magnesium, 6 milligrams per deciliter. Which nursing action is appropriate? A. Discontinue the infusion immediately. B. Continue therapy and monitor the client closely. C. Administer calcium gluconate. D. Restrict all oral fluids. Answer. B. Continue therapy and monitor the client closely. Rationale. These findings are consistent with a therapeutic magnesium level and adequate respiratory status, urine output, and reflexes. Continued monitoring is appropriate. Question 20. A client receiving vancomycin for methicillin-resistant Staphylococcus aureus, MRSA, develops gradually increasing serum creatinine levels over several days. Which adverse effect should the nurse suspect? A. Hepatotoxicity. B. Ototoxicity only. C. Nephrotoxicity. D. Hyperglycemia. Answer. C. Nephrotoxicity. Rationale. Vancomycin is associated with nephrotoxicity, particularly with prolonged therapy or elevated drug levels. Rising serum creatinine warrants prompt evaluation and possible dosage adjustment. Question 21. A 55-year-old client with type 2 diabetes mellitus is prescribed insulin Lispro before meals and insulin Glargine at bedtime. Before lunch, the client's blood glucose is 318 milligrams per deciliter, but the client states, "I'm not going to eat because I'm nauseated." Which nursing action is most appropriate? A. Hold both insulin doses until the client feels better. B. Administer the prescribed insulin Lispro without further assessment. C. Notify the provider because the rapid-acting insulin dose may need adjustment if the client is not eating. D. Administer the bedtime insulin Glargine instead. Answer. C. Notify the provider because the rapid-acting insulin dose may need adjustment if the client is not eating. Rationale. Rapid-acting insulin is intended to cover carbohydrate intake. Administering it without food can precipitate hypoglycemia. The nurse should collaborate with the provider regarding insulin management while the client is not eating. Question 22. A client is receiving an 4-heparin infusion for an acute pulmonary embolism. During the shift, the nurse observes hematuria and bleeding from the 4 insertion site. Which assessment finding requires the nurse's highest priority intervention? A. APTT of 34 seconds. B. Platelet count of 240,000/mm superscript 3. C. Blood pressure of 82/48 mm of mercury with increasing confusion. D. Heart rate of 88 beats/minute. Answer. C. Blood pressure of 82/48 mm of mercury with increasing confusion. Rationale. Hypotension and altered mental status suggest significant blood loss and possible hemorrhagic shock. Stabilizing circulation and stopping the anticoagulant are immediate priorities. Question 23. A client taking warfarin for a mechanical heart valve tells the nurse, "I forgot yesterday's dose. I'll take 2 tablets today to make up for it." Which response by the nurse is most appropriate? A. That is the correct way to maintain your INR. B. Double today's dose only if you notice bruising. C. Do not double the dose. Contact your healthcare provider for instructions. D. Skip today's dose as well. Answer. C. Do not double the dose. Contact your healthcare provider for instructions. Rationale. Doubling a missed warfarin dose significantly increases the risk of bleeding. Clients should contact their healthcare provider for individualized instructions. Question 24. A client with chronic heart failure has been receiving Digoxin. The nurse reviews the following morning laboratory results. Potassium, 3.0 milliequivalent/L. Magnesium, 1.4 milligrams per deciliter. Digoxin level, 1.8 nanograms per milliliter. Which finding places the client at the greatest risk for digoxin toxicity? A. Therapeutic digoxin level. B. Low potassium and low magnesium levels. C. Normal renal function. D. Heart rate of 78 beats/minute. Answer. B. Low potassium and low magnesium levels. Rationale: hypokalemia and hypomagnesemia significantly increase myocardial sensitivity to digoxin, predisposing the client to toxicity even when the serum digoxin level is within the therapeutic range. Question 25. A client receiving 4 furosemide for acute decompensated heart failure has produced 2,800 milliliters of urine over the past 8 hours. Which assessment finding should the nurse report immediately? A. Improved breath sounds. B. Weight loss of 1 kilogram. C. Potassium level of 2.7 milliequivalent/L. D. Decreased ankle edema. Answer. C. Potassium level of 2.7 milliequivalent/L. Rationale: severe hypokalemia is a life-threatening complication of loop diuretics and can lead to fatal cardiac dysrhythmias. Prompt replacement is required. Question 26. A client receiving 4 morphine after abdominal surgery suddenly becomes difficult to awaken. Vital signs are: respiratory rate, 8 breaths/minute. Blood pressure, 90/54 millimeter of mercury. Oxygen saturation, 86%. After stopping the morphine infusion, what is the nurse's next priority action? A. Encourage the client to cough. B. Administer naloxone as prescribed. C. Offer oral fluids. D. Place the client in high Fowler's position and reassess in 1 hour. Answer. B. Administer naloxone as prescribed. Rationale: respiratory depression is the most serious adverse effect of opioid therapy. Naloxone rapidly reverses opioid-induced respiratory depression. Question 27. A client is brought to the emergency department after a bee sting. Despite receiving epinephrine, the client develops worsening facial swelling and stridor. Which nursing intervention has the highest priority? A. Obtain another set of routine laboratory tests. B. Prepare for advanced airway management. C. Encourage oral fluids. D. Place the client on bed rest. Answer. B. Prepare for advanced airway management. Rationale: progressive airway swelling despite epinephrine places the client at immediate risk for complete airway obstruction. Airway management takes priority. Question 28. A nurse is preparing to administer 4 potassium chloride. Which action requires immediate correction? A. Using an infusion pump. B. Confirming urine output before administration. C. Administering potassium through a patent 4 line. D. Programming the infusion to run over 15 minutes for 40 milliequivalent. Answer. D. Programming the infusion to run over 15 minutes for 40 milliequivalent. Rationale: potassium chloride must never be infused rapidly because rapid administration can cause fatal cardiac dysrhythmias or cardiac arrest. It should always be administered at a controlled rate using an infusion pump. Question 29. A client receiving magnesium sulfate for severe preeclampsia has these assessment findings. Respiratory rate, 10 breaths/minute. Patellar reflexes, 1+. Urine output, 18 milliliters per hour. Serum magnesium, 9.5 milligrams per deciliter. Which nursing intervention should occur first? A. Continue the infusion and reassess in 1 hour. B. Increase the infusion rate. C. Stop the magnesium sulfate infusion and prepare to administer calcium gluconate. D. Encourage ambulation. Answer. C. Stop the magnesium sulfate infusion and prepare to administer calcium gluconate. Rationale: respiratory depression, oliguria, diminished reflexes, and elevated magnesium levels indicate magnesium toxicity. Immediate discontinuation of the infusion and administration of calcium gluconate are essential. Question 30. A client receiving 4 vancomycin asks why the nurse is infusing the medication over 2 hours instead of rapidly. Which response by the nurse is most accurate? A. Infusing it slowly reduces the risk of red man syndrome. B. The medication becomes ineffective if infused quickly. C. Rapid infusion causes hypoglycemia. D. Slow infusion prevents liver failure. Answer. A. Infusing it slowly reduces the risk of red man syndrome. Rationale: vancomycin should be infused slowly to reduce the risk of red man syndrome. An infusion-related reaction characterized by flushing, pruritus, hypotension, and erythema. Rapid infusion increases the likelihood of this adverse reaction. Question 31. A 67-year-old client with septic shock is receiving a continuous 4 infusion of regular insulin to control stress-induced hyperglycemia. During hourly assessment, the nurse notes the following findings. Blood glucose, 78 mg per deciliter, previously 162 mg per deciliter 1 hour ago. Heart rate, 104 beats/minute. Blood pressure, 112/68 mmHg. The client is awake, but reports feeling shaky and diaphoretic. Which nursing action is the priority? A. Continue the insulin infusion at the current rate. B. Administer 15 g of a rapid-acting carbohydrate if the client can safely swallow or follow the hypoglycemia protocol, then reassess. C. Administer the next scheduled insulin dose. D. Restrict oral intake until the blood glucose falls below 70 mg per deciliter. Answer. B. Administer 15 g of a rapid-acting carbohydrate if the client can safely swallow or follow the hypoglycemia protocol, then reassess. Rationale: although 78 mg per deciliter is within the lower end of the normal range, the client is symptomatic and has experienced a rapid glucose decline. Prompt treatment according to the facility's hypoglycemia protocol helps prevent progression to severe hypoglycemia. Question 32. A client receiving unfractionated heparin suddenly reports severe headache, blurred vision, and nausea. Assessment reveals a blood pressure of 176/94 mmHg and increasing lethargy. Which action should the nurse take first? A. Administer the prescribed pain medication. B. Stop the heparin infusion and notify the provider immediately. C. Encourage oral fluids. D. Place the client in Trendelenburg position. Answer. B. Stop the heparin infusion and notify the provider immediately. Rationale: these findings raise concern for intracranial hemorrhage, a life-threatening complication of anticoagulation. The heparin infusion should be stopped immediately while further evaluation and reversal therapy are initiated. Question 33. A client taking warfarin is scheduled for elective surgery in 1 week. Which statement by the client indicates a need for further teaching? A. I'll tell my surgeon that I'm taking warfarin. B. I'll ask my healthcare provider when to stop taking my warfarin before surgery. C. I'll continue taking warfarin until the morning of surgery unless told otherwise. D. I'll watch for signs of bleeding while taking this medication. Answer. C. I'll continue taking warfarin until the morning of surgery unless told otherwise. Rationale: warfarin is usually discontinued several days before elective surgery to reduce bleeding risk. The timing should always be directed by the healthcare provider. Question 34. A client receiving digoxin for heart failure develops new-onset confusion, anorexia, and frequent premature ventricular contractions. Which laboratory value would most strongly support the nurse's suspicion of digoxin toxicity? A. Potassium 2.8 milliequivalent/L. B. Sodium 140 milliequivalent/L. C. Calcium 9.4 mg per deciliter. D. Glucose 102 mg per deciliter. Answer. A. Potassium 2.8 milliequivalent/L. Rationale: hypokalemia greatly increases the risk of digoxin toxicity by enhancing digoxin's effects on the myocardium, leading to dysrhythmias and neurological symptoms. Question 35. A client receiving 4-furosemide has the following assessment findings. Blood pressure, 86/50 mm of mercury. Heart rate, 118 beats/minute. Dry oral mucosa. Urine output, 3,500 milliliters during the last shift. Which nursing action is most appropriate? A. Continue the medication because increased urine output is expected. B. Hold the next dose and notify the provider. C. Encourage the client to ambulate. D. Restrict oral fluids. Answer. B. Hold the next dose and notify the provider. Rationale: excessive diuresis has likely caused hypovolemia and hypotension. The medication should be withheld while the provider is notified for further evaluation. Question 36. A postoperative client receiving morphine reports severe pain, rated 9 out of 10. Before administering the next dose, the nurse notes: respiratory rate, 10 breaths/minute. Oxygen saturation, 90%. The client is difficult to arouse. What is the nurse's priority action? A. Administer the prescribed morphine. B. Hold the morphine and assess for opioid-induced respiratory depression. C. Reassure the client that pain is expected. D. Encourage the client to ambulate. Answer: B. Hold the morphine and assess for opioid-induced respiratory depression. Rationale: respiratory depression is the most dangerous adverse effect of morphine. The medication should be withheld until the client's respiratory status is stabilized. Question 37. A client with anaphylaxis receives intramuscular epinephrine. Which assessment finding indicates the medication has been effective? A. Persistent wheezing with decreased oxygen saturation. B. Improved blood pressure and decreased inspiratory wheezing. C. Increasing facial swelling. D. Development of stridor. Answer: B. Improved blood pressure and decreased inspiratory wheezing. Rationale: epinephrine relieves bronchospasm, increases blood pressure, and reduces airway edema, indicating successful treatment of anaphylaxis. Question 38. A nurse prepares to administer potassium chloride through a peripheral 4. Which finding requires the nurse to question the prescription before administration? A. Urine output of 10 milliliters per hour. B. Serum potassium of 2.9 milliequivalent/L. C. Continuous ECG monitoring is available. D. Infusion pump is programmed correctly. Answer: A. Urine output of 10 milliliters per hour. Rationale: oliguria suggests impaired renal function. Administering potassium when urine output is inadequate increases the risk of dangerous hyperkalemia. Question 39. A client receiving magnesium sulfate for preeclampsia suddenly develops absent deep tendon reflexes. Respiratory rate is 11 breaths/minute, and urine output has declined to 22 milliliters per hour. Which nursing action has the highest priority? A. Continue the infusion because seizure prevention is the priority. B. Stop the infusion immediately and prepare calcium gluconate. C. Encourage oral hydration. D. Reassess in 1 hour. Answer: B. Stop the infusion immediately and prepare calcium gluconate. Rationale: absent reflexes, respiratory depression, and reduced urine output are classic signs of magnesium toxicity. Immediate intervention is required to prevent respiratory arrest. Question 40. A client is receiving vancomycin for MRSA bacteremia. Which assessment finding should the nurse report immediately because it may indicate ototoxicity? A. Ringing in the ears and difficulty hearing conversations. B. Mild nausea after meals. C. Dry mouth. D. Increased appetite. Answer: A. Ringing in the ears and difficulty hearing conversations. Rationale: tinnitus and hearing loss are early signs of vancomycin-induced ototoxicity. Prompt reporting may prevent permanent auditory damage. Question 41. A 70-year-old client with heart failure and type 2 diabetes is admitted with acute pulmonary edema. The client receives 4 furosemide, regular insulin for hyperglycemia, and digoxin. 4 hours later, the nurse reviews the following assessment data: potassium, 2.8 milliequivalent/L. Blood glucose, 148 milligrams per deciliter. Apical pulse, 54 beats/minute. The client reports nausea and seeing yellow halos around lights. Which nursing action is the highest priority? A. Administer the scheduled digoxin dose. B. Hold the digoxin and notify the provider immediately. C. Administer the next dose of furosemide. D. Encourage the client to increase activity. Answer: B. Hold the digoxin and notify the provider immediately. Rationale: hypokalemia significantly increases the risk of digoxin toxicity. Bradycardia, nausea, and yellow vision are classic signs of toxicity. Digoxin should be withheld and the provider notified promptly. Question 42. A client receiving a continuous unfractionated heparin infusion develops sudden severe abdominal pain, dizziness, and hypotension. The abdomen is rigid and the heart rate is 128 beats/minute. Which action should the nurse take first? A. Administer the scheduled heparin dose. B. Stop the heparin infusion and activate the rapid response team. C. Reposition the client onto the left side. D. Encourage oral fluid intake. Answer. B. Stop the heparin infusion and activate the rapid response team. Rationale. These findings suggest internal hemorrhage with possible hemorrhagic shock. Immediate discontinuation of heparin and emergency intervention are the priorities. Question 43. A client taking warfarin for chronic atrial fibrillation is discharged home. Which statement by the client indicates correct understanding of discharge teaching? A. I'll take ibuprofen whenever I have pain. B. I'll notify my healthcare provider if I notice black or tarry stools. C. I'll double my dose if I miss one. D. I no longer need routine INR testing. Answer. B. I'll notify my healthcare provider if I notice black or tarry stools. Rationale. Melena is a sign of gastrointestinal bleeding and requires immediate medical evaluation. NSAIDs increase bleeding risk. Missed doses should not be doubled, and routine INR monitoring is essential. Question 44. A client with chronic heart failure is prescribed digoxin. Which assessment finding requires the nurse to withhold the medication? A. Apical pulse of 58 beats/minute. B. Blood pressure of 132/78 mmHg. C. Respiratory rate of 18 breaths/minute. D. Oxygen saturation of 97%. Answer. A. Apical pulse of 58 beats/minute. Rationale. Digoxin should generally be withheld if the adult apical pulse is below 60 beats/minute because of the increased risk of symptomatic bradycardia. Question 45. A client receiving furosemide for acute heart failure reports ringing in the ears during the infusion. Which nursing action is most appropriate? A. Continue the infusion because this is expected. B. Slow or stop the infusion and notify the provider. C. Administer another dose immediately. D. Encourage the client to ambulate. Answer. B. Slow or stop the infusion and notify the provider. Rationale. Rapid administration of furosemide may cause ototoxicity, manifested by tinnitus or hearing changes. Prompt intervention can reduce the risk of permanent hearing loss. Question 46. A postoperative client has received several doses of morphine over the past 12 hours. Which assessment finding requires immediate nursing intervention? A. Pain rating of 6 out of 10. B. Respiratory rate of 7 breaths/minute. C. Heart rate of 94 beats/minute. D. Blood pressure of 138/82 mmHg. Answer. B. Respiratory rate of 7 breaths/minute. Rationale. Severe respiratory depression is the most life-threatening complication of opioid therapy and requires immediate intervention, including withholding opioids, supporting ventilation, and administering naloxone if prescribed. Question 47. A client with severe anaphylaxis receives epinephrine. Which assessment finding demonstrates that the medication is producing the desired therapeutic effect? A. Blood pressure increases from 76/42 millimeter of mercury to 112/70 mmHg, and wheezing decreases. B. Respiratory distress worsens. C. Oxygen saturation decreases to 84%. D. Stridor becomes more pronounced. Answer. A. Blood pressure increases from 76/42 millimeter of mercury to 112/70 mmHg, and wheezing decreases. Rationale. Epinephrine reverses vasodilation and bronchoconstriction, improving blood pressure and relieving airway obstruction during anaphylaxis. Question 48. A client with hypokalemia is prescribed for potassium chloride. Which action by the nurse is appropriate? A. Administer potassium by 4 push over 5 minutes. B. Dilute potassium appropriately and administer it using an infusion pump. C. Mix potassium with other 4 medications to reduce discomfort. D. Administer potassium regardless of urine output. Answer. B. Dilute potassium appropriately and administer it using an infusion pump. Rationale. For potassium chloride must always be diluted and infused using an infusion pump at the prescribed rate. It should never be administered by 4 push, and adequate renal function must be confirmed. Question 49. A postpartum client is receiving magnesium sulfate for seizure prophylaxis. Which assessment finding indicates the medication is currently within the therapeutic range? A. Respiratory rate of 18 breaths/minute. Urine output of 40 milliliters per hour, and patellar reflexes 2+. B. Respiratory rate of 8 breaths/minute and absent reflexes. C. Urine output of 12 milliliters per hour. D. Increasing lethargy with absent deep tendon reflexes. Answer. A. Respiratory rate of 18 breaths/minute. Urine output of 40 milliliters per hour, and patellar reflexes 2+. Rationale: normal respirations, adequate urine output, and intact deep tendon reflexes indicate safe, therapeutic magnesium sulfate administration. The other findings suggest magnesium toxicity. Question 50. A client is receiving 4 vancomycin for infective endocarditis. Before administering the next dose, the nurse reviews the following data. Serum creatinine increased from 0.9 milligrams per deciliter to 2.1 milligrams per deciliter over 3 days. The client reports ringing in the ears. Vancomycin trough level is elevated. Which nursing action is most appropriate? A. Administer the medication as prescribed because infection treatment is the priority. B. Hold the vancomycin dose and notify the healthcare provider. C. Increase the infusion rate to shorten administration time. D. Administer furosemide before the vancomycin infusion. Answer. B. Hold the vancomycin dose and notify the healthcare provider. Rationale: rising serum creatinine, elevated trough levels, and tinnitus strongly suggest vancomycin toxicity, nephrotoxicity, and possible ototoxicity. The medication should be withheld, and the provider notified immediately for reassessment and dosage adjustment. Excellent work completing all 50 questions. Mastering these 10 high-yield medications gives you a strong foundation for answering many of the toughest NCLEX pharmacology and clinical judgment questions. If you missed any, review the rationales and repeat the questions until the nursing interventions and safety priorities become second nature. Consistent practice is one of the best ways to build confidence and improve your exam performance. Keep studying, stay focused, and all the best on your NCLEX journey.